Welcome to DBC Diaries episode 59. Today we're with returning patient Gary. Gary suffered a stroke a few years back and he's had some issues with it. The big thing being aphasia, and this actually inhibits your ability to speak. He had gotten to a point where he was almost not speaking. It was getting so bad. And fortunately, he heard about us. He came down for stem cells, and there's some great studies in regards to doing the intrathecal treatment with mesenchymal stem cells. That means we put them into your lower back, into the spinal cord fluid, so they can go up to the brain. And for him, it worked really well. You'll see here, he's speaking now. He's, pronouncing his words. It's not 100%, but he's getting much, much better. And he was so excited about the results. He wanted to share them with you. When I called him last, he actually asked if he could film one of these with us. So he wanted to share that with you. I hope it helps people at home. This time he's doing a little bit more. He's doing intrathecal again. He's doing an IV. He's doing a nebulized. The nebulized can also get cells to the brain because they go to the mucous membrane and then get through to the carotid artery to the brain. So really cool stuff. We're hoping he's just going to keep getting better and better. So stay tuned and see how Gary is fighting back on stroke recovery. DBC Diaries Day 1. Today is arrival day, so Gary's been here before. He knows you come through the airport, you go through baggage claim, then you run through what we call the gauntlet. There's tons of people trying to flag you down, trying to sell you a timeshare or get you in a taxi. Just look down, don't make eye contact, go through, and then you get into the airport and you walk outside and you'll see our driver with a sign with your name on it. They've got the DBC logo on it. They'll take you in one of our 8 Ford Expeditions to your hotel and get you all settled in so you can get started for treatment the next day.
We'll start the day by taking the patient's vital signs and collecting the necessary blood sample for lab tests.
DBC Diaries Day 2. Today is blood work. So today, Gary and his wife Michelle are both getting their blood work done. Michelle was also getting some MRIs for some joints that she was doing. This is real simple. You come in, quick blood draw. We need you to be fasted. Nurses go over vitals. Then for the MRIs, we do require an MRI for any joint treatment. So that's required. It's just part of treatment. If you're doing knees, shoulders, hips, whatever it is, we do a quick scan. It takes about 40 minutes per joint. And that way we've got real data to compare and show with the doctors so you can see what's going on.
So today, Gary Jones is going to come to the consultation. He's going to have an intrathecal treatment and nebulizer treatment, and he comes with his wife. She's going to have IV treatment, the knee and hip treatment. So we already do the treatment with Gary for the intrathecal, and he has a lot of results.
Well, today is consultation with the doctors. So Gary and Michelle came in, met with the doctors, went over Gary's blood work, asked some questions about how he's doing now versus before. And Michelle did her MRIs, which we review with the doctor just to show her what's going on and make sure it's a good fit. As long as everything's a go, we then go upstairs to accounting department and take care of payment. Once that's done, we get you back to your hotel so you can rest up, relax, hang out at the beach the rest of the day.
After a new medical consultation will begin, Michelle and Gary's treatment at the same time in different treatment rooms.
Today's treatment day, so you come in, meet with the doctors, any last questions, and then we get going with treatment. It's real simple. We go over everything. The treatments are pretty straightforward. The intrathecal, it sounds scary, but it's actually very simple. They go into your lower back. They put the needle in. It's so tiny, you barely feel anything. And then they take out a little bit of spinal cord fluid and then put in the mesenchymal stem cells. And then once that's done, you just kind of rest, do the IV. And then when that's done, Gary started up with the nebulized so we could breathe in those cells, get them to the lungs, into the brain, and then done. He was doing all that while Michelle is getting her joints taken care of. And real simple. So it's pretty anticlimactic for what it is. You know, you're dealing with all these issues and it's a couple of quick pokes or injections and it's done. So very simple. Once done, especially with the intrathecal treatment and with joints, we recommend you go back, rest and relax at your hotel and take it easy. And with the intrathecal, we do recommend the day after you have a whole day off. There is a chance of getting a migraine, and it's better just to be able to rest up that day just in case, and good to go. So that's it. We'll get you back to your hotel to rest up. Hi, this is Josh, Dream Body Clinic. Welcome to DBC Diaries episode 59. I am here with returning patient Gary. Welcome back, Gary.
Welcome.
Thanks. So we were just talking and you were here last year and you were saying you initially had a TIA, which is kind of like a mini stroke, right?
Yeah.
That's probably the easiest way to explain it. And then you had a full-on stroke and you said you were experiencing aphasia, which means it's getting tougher to talk. Right?
Yeah.
And so last year we did the intrathecal and we did cerebrolysin, and I guess you're back again. So curious how it worked for you, how you're feeling and what's going on.
I think it staved off the treatment. I think it staved off the onset of the disease.
Yeah, you said it felt like the aphasia was really starting to hit you, and that means, I mean, you could have lost the ability to communicate, right? I mean, that's kind of what that does.
Yeah.
And
I was a financial advisor in my prior life, but I had to retire.
Yeah, got it. So it's tough. So you've had that. We did the intrathecal and cerebrolysin first. And I mean, your wife is here too. She was doing, I think, her hip. So the cells have worked good for you.
And the knee.
And the knee, correct. And, you know, we did another round this time of the intrathecal. We tried the nebulized this time too.
Yeah.
That'll get the cells to the mucous membrane so they can get to the carotid artery and go to the brain. So we're hitting it from every angle we can.
Yeah.
And hopefully, you know, this is the thing. We always hope it's one and done, but, you know, stroke recovery is difficult and it's not always that. So sometimes it might take a couple of treatments, but as long as we keep getting improvements, it's better than anything else they have out there.
Yes, it is.
Yeah, because in the U.S., they'll throw some pills at you, and you know, just that's about all they can do. I mean, they really don't have much for it, unfortunately. So my mom had a TIA a few years ago, and you know, that's when she found out she had a hole in her heart. And I found out I had a hole in my heart. We got that fixed. And I was talking with a potential patient yesterday. It's about my age, like early 40s. And he had a full-on stroke because that hole in his heart. And the standard of care is insane. Like, they don't want to fix these kind of issues. And, you know, there's a lot of things you can do. So I always tell people at home too, there's certain tests you should look into as you start getting older. Like, I just did a calcium score. I wanted to see if there was any plaque buildup.
Me too.
Yeah, you did one of those? Okay.
Yeah.
And have they recommended like any other scans to kind of check for potential stroke markers?
They have done all this could.
Yeah. So they're always looking into the blood work. You know, there's ultrasounds, MRIs. The only problem with the MRIs is they typically want to use contrast. And
PET scan, and they've done that.
So a PET scan would probably be a better option if you're trying to be preventative. Look, you don't want to do them too often either because there's a lot of radiation and such, but you know, these are things we have to start thinking about as we get older. And the great part with something like this, the IV of stem cells like you just did, is it's very preventative. You know, a lot of things like stroke, diseases, you know, aging, it all starts with inflammation. And the mesenchymal stem cells, they target inflammation, they reduce it, if not eliminate it, and fix the underlying problem. So, you know, there's a huge, huge area of like being preventative just with like the IV. We're also seeing a lot of with DNA methylation tests that you can check your biological age before and after. And the IV...
59.
59, okay. Got it.
Watch.
Yeah?
Yeah.
Okay. So
Garmin.
Oh, okay, got it. So with the watch. But with the DNA methylation, you've not done that, have you?
No.
Yeah, so with the DNA methylation test, it'll show you your age versus biological on the cellular level, and we're getting really good results that people that do the IV and come back are consistently seeing that age go down. So, you know, we don't expect to live forever, but we want to get to the end as best we can. That's our goal here, right? So yeah. Well, Gary, thanks so much for joining us. Thanks for sharing, and
Thank you.
you know, we'll keep going and get you better and go from there. All right.
Thank you, Josh.
Thank you. I'm Josh, Dreambody Clinic. If you want to learn more, go to www.dreambody.clinic. You can call us toll free at 888-704-3977. I'm Josh. Happy to help. DBC Diaries Day 5. Today's a rest day. When people do the intrathecal, we always recommend they have a day to rest and relax, which we do. So nothing on this day, you know, just enjoy your room, enjoy the beach, hang out, just take it real easy, nothing major. DBC Diaries Day 6, today's departure day. So I want to thank Gary for sharing this with everyone. You know, it's great seeing him just getting better. We know it's always a long, tough road recovering from a stroke, but we're doing our best to help people out with that. Now, the studies do show the sooner you can get an intrathecal treatment after a stroke, the higher the chance of success. If you can get it done within 1 year of having a stroke, it's upwards of 90% success rate. So if you or anyone you know or love has had a stroke and needs to recover, make sure they get a hold of us. You can reach us at www.dreambody.clinic. Scroll down on the home page, all the treatments are listed. You can click, they got info and prices, everything's there. And then if you want to call us, we do free consultations. You call anytime, toll free at 888-704-3977. I'm Josh, happy to help.